Hi, I'm Phil.
Hi, I'm Kate.
Today we're going to talk about one of the best ways that we know of to treat warts. So often people who have warts, plantar warts, either on their foot, legs, or even hands and arms, have tried many things to fix them. So let's talk about the ways people often come, like the things people say they've tried.
Yeah, often I get parents bringing their kids in and they've been to the doctors, they've gotten it frozen off, they've had to try to get it cut out, but maybe the patient's says it's too painful, doesn't want that done. They've tried different things from the pharmacy to sort of burn it away, and all the other home remedies as well, banana peels, sticky tape, all of that.
Peels.
Yeah.
All the funny things we hear. So,
and it just doesn't work.
well, it's funny,
in some cases, yeah.
Sometimes it does. So there will be someone who the banana peel worked.
Yeah.
That's why the story is so popular. But I'd say 9 out of 10 people, the banana's not going to work. The problem with some of the other therapies, and I know I've done this in the past, is freezing them, for example. It's really painful.
And sometimes requires dressings afterwards as well, which if kids are running around at school, they're not going to stay on very long either. Yeah.
That's right. And a wound, any wound, whether it's from a cryotherapy or from dissections and cutting it out, it's going to mean time off the foot. So,
exactly.
Yeah. Now, obviously, we're going to talk about what we want to talk about, which is microwave. So all of the treatments we've already talked about are mainly about removing the wart tissue, trying to either remove it or actually destroying the tissue with either heat or with cold by freezing it. So the theory behind that is destroy the tissue and either cut it out or make it fall out. Yeah. The treatment we're going to talk about, which is our Swift microwave, is totally different because we're not actually trying to burn a hole in the foot or destroy the wart tissue. We're trying to do something else. So
exactly right.
What is it, Kate, that we're actually doing with the microwave?
Yeah, so the Swift microwave, it does heat up the tissue a little bit. Doesn't burn, it's not painful. If it's painful, we can dial the dose down so it's comfortable. But it also sort of attacks the immune cells as well. So it tells the immune cells that there's something there, tells the body that there's a virus there, and gets rid of the virus at the same time as treating the lesion. Yeah.
It's so cool. I mean, I used to hate seeing warts. I genuinely, in my whole career of nearly 20 years now, until we had this machine, I dreaded it because the results were so unreliable with these cryo and other treatments. But now I love it because it's such a predictable result.
Get really good results and really limits the pain that the patient experiences as well.
It's really good, which makes it great for kids or just anyone who doesn't like pain, which is pretty much everyone. The thing about the verruca lesions, which is caused by the virus that gets into the skin, is it's really good at hiding in the skin. So that's why if you try and cut it out or burn it out, there's always going to be a few cells left, which means often not only are the treatments painful, but the virus will just come back, the lesion grows back, and it's so disappointing. Particularly if it's your kids, you've dragged them there to the GP, 3 or 4 times. That's not fun, to do that. So the cool thing with this treatment is, like you said, Kate, it's using your own body to kill the virus.
Exactly.
So when we heat the tissue, we get that little spike of heat, and the cells release the protein that then their body recognises and creates antibodies for. So now, I'm going to ask you questions about it, Kate, because these are the questions I know people are going to be having at home. Does it cause pain?
So it does get a little bit warm, but it shouldn't be painful. We need to use a little bit of heat, but we don't want to burn the foot, burn the toe or anything like that, cause any major pain to the patient. And it's all over really quickly as well too. It's a split second where it gets a little bit warm and then it stops. We do that over and over, but we can dial the machine up and down depending on the pain levels as well.
And so the next question people have is, well, do I have to have a bandage on it afterwards, or can I walk on it?
So there's nothing you need to do afterwards, which is awesome. You can just leave it open, go to school, go to work the next day, go swimming, that's fine as well too. Just live your life like normal, definitely.
So how long does it take for the wart to go?
It depends on the patient, depends on the wart. Most cases we recommend between 3 and 4 sessions of this Swift treatment, 1 month apart as well too. So it's a little bit of a longer process, but it gets those long-term results that we're looking for as well.
The issue is, if you look at the timeline here, so behind Kate here is the wart tissue, and this is the microwave sinking, it basically penetrating with that microwave energy. Now, the issue is the depth of the dermis It's really about 10 to 12 weeks, particularly on the plantar foot, the underneath of the foot, to get a full cycle of cells from the lower dermis up to the epidermis. So it's not going to disappear. What we'll see is that the wart will actually die from the base up. So you'll see in the first month a little bit of change, little black dots in it. But each month we just start seeing the wart get thinner and thinner and then peel off or just disappear.
Yeah.
So it's actually really exciting.
It is, and it's rewarding for the patients as well, especially if it's a painful wart. They've had it for ages, and then the relief that they get.
I think the record is a patient with a 20-year history.
Yeah,
that's the person I'm thinking of. Who met all the treatments you can think of. Who's got great results.
Really good results. Yeah.
And I think even the youngest patient, I think we might have had a 2 or 3 year old recently.
Yeah.
And it's so cool because we can dial it right down to not cause them too much pain. Yeah. So look, I reckon that's probably given people the information they need. Here's just some before and afters, but this is an example of a 12-week protocol. So what? 1 month, 2 months, 3 months. So really, it's quite a miraculous recovery for people. It's just so cool to see.
It's awesome.
Yeah, that's probably enough information, I think, for people. If you want to know more, just give us a call or jump on our website. We've got a lot more information there. But if you've got a plantar wart or your child or someone you know, best thing to do is book in for an appointment and we'll check it out. And if we're ready to go, we can do the first treatment on the first visit right away, get it started. So, but give us a call if you want to know more information. And thank you for watching our video. Bye.
See ya.